a family who really do need our help and prayers. Good morning to you all.
Good morning.
Good morning. Good to see you, Polly.
Good to see you both as well, all of you. Right, tell us what's going on. This is a story about baby Kit. Baby Kit is your fourth baby. He's a boy. And I want to hear it in your words because this is horrific. Our viewers are going to be horrified by this. So should we start about when you went? How was your pregnancy? Let's start with that. How was your pregnancy?
Pregnancy was pretty quiet and uneventful. I mean, we took the time to we were just hanging out with our children in the jungle of Hawaii.
We lived on the Big Island, and we had a really slow life of just going on long walks and eating really healthy. Like I would make her the same menu every day throughout the day to make sure the baby was like well fed, and he was really responsive in the womb. We would squeeze his belly twice. He would kick back twice.
Every time. And my 17-year-old wouldn't even let me lift a finger around the house. She would do all the dishes. I would come home anytime I would go anywhere, or even just out for our walk. We'd come back and my bed would be made. The house would be clean. Like it was the most peaceful, everybody was so excited.
It was picturesque.
Yeah.
And then overnight, everything switched into a nightmare, and we've been living in that for the last 8 months straight.
Okay, so this is breaking. We're live with you in Hawaii. We just want everyone to know this. And this happened 8 months ago. So your baby Kit is 8 months old today.
Mm-hmm.
So let's go back. So how was your birth?
So one day I got up and I just didn't feel him moving as much. And he usually had a pretty good rhythm with his movement. And in retrospect, I really think that he was just up all night. And so I think he had been moving, because at nighttime when we would lay down, he would just go wild it was like always he was trying to get out of my belly and get to him. And he would like try to push into him when I would lay down at night and try to cuddle him. And I really think he was just up all night. And so when I got up that morning and he just wasn't as active. And of course I just had this, like, you're just overly,
you're cautious when you have a baby that's on a normal rhythm, and then you can't feel him moving. And then we kept trying to move him and we just couldn't get movement. And it went on throughout the morning and then into the early afternoon. And we just were poking and prodding and moving and going on a drive.
He just didn't want to do anything. And so we went to the hospital.
We decided to go into the emergency room, and on the Big Island, we were on the Hilo side. So we went to Hilo Hospital.
Yeah. And I mean, on this island, prenatal care is kind of a joke. It takes 6 months just to get into a first visit with a prenatal provider.
And pregnancy is only 9 months long. So.
Yeah. Yeah. So it was one of those things where you're kind of in this situation. After I had him, they told me, you should go ahead and sign up with our birth practice so that in the future, when you get pregnant again, or if you get pregnant again, the waiting list will be shorter. It'll only be 3 or 4 months to see somebody. I was kind of floored when they said that to me.
So you did not have any vaccines while you were pregnant?
No. And
so continue.
Yeah, we had been trying to find a midwife that we really liked, and we hadn't found one that we wanted to birth with yet, but we had been seeing midwives, and we knew exactly.
We knew how pregnant she was. We knew her fundal height. We were exactly on.
He was measuring exactly on, anybody that came and listened to him, he was good. Like, I was healthy, my weight was good, everything was on track. And
so they take us in at the hospital immediately, and they find a heartbeat, and we're like, okay, great, he has a heartbeat. They put the monitor on, and we're like, okay, this is awesome.
And it was a good heartbeat.
Yeah, and it was strong.
It was good.
And then they said that they wanted to do a biophysical profile, and
when they did the biophysical profile, they sent a gentleman in who. He quite literally said to us, I don't really know what they want me to do. I'm not sure what she wants me to do. And he wouldn't I said, can I
this is a technician who had never done it before.
But wait, I don't even know what it is. What is that profile thing you're talking about?
So a biophysical profile is a measurement tool that is used to, assess the well-being of the baby. So it measures like amniotic fluid, it measures movement, flexion, extension, breathing movements. It takes a really skilled practitioner. I used to do it when I was in the hospital doing high risk. And if you're going to base having a C-section on a biophysical profile on a premature baby, you make sure that you're doing it correctly. You have a backup doctor that does it as well. It's a test that takes skill and precision, and they based this test on the fact that they needed to do this emergency C-section on a 29-weeker.
Okay, so he was 29 weeks. That's really important. He was only 29 weeks.
The
Aw.
test, and you can see in this photo here, his cannula was not even in his nose.
They left him like this after they took him out. They left him in the little the nursery without his cannulas in for 10-15 minutes at a time.
So just backing up a tiny bit. So the biophysical profile, the technician admits that he's never done it before, and they were having Sam hold still while they're doing this ultrasound test. You're supposed to create movement, try to inspire movement with the baby. They would not give her ice. They would not give her anything to drink. They would not let us talk. They wouldn't. It was completely silent in the room, and
it wasn't allowed to move. Which
after
was so strange.
this test, which was about an hour and a half long, after that happened, and again, the baby's heartbeat was fine the entire time. A doctor wearing a mask came into the room, and she said, "I want to cut your baby out in 20 minutes."
Those were her.
Wow.
And
I
then
want
the
to cut your
nurse,
baby out.
and the nurse said, "We can't even do 20 minutes." And the doctor said, "I don't care. We need to get him out now."
But why? What was the reason for that?
Because of the low
score
score on the biophysical
Yeah.
profile.
And just quickly to Angela on that, does that even make sense to you? He had a strong heartbeat. What's the problem?
Yeah. I would have to look at the whole picture of seeing the fetal monitor strip. I would never recommend taking a baby out with a low score if the heartbeat looks good. So I would have to see the whole picture to see what justified them to cut a 29-weeker out. They didn't give her betamethasone, which is something that is absolutely necessary to help mature the baby's lungs if you're going to take a baby out that soon.
And we had asked them 2 times for it. Yeah. We even asked for an OB. The OB who had delivered my previous baby was working at the hospital at that time. And I asked if I could talk to him. I requested that they send him into the room or that I be allowed to talk to him.
So yeah,
and they refused me.
We were refused a second opinion. We were refused betamethasone. We were refused the right to even leave. And the only option that we had was to agree to a C-section, which we knew would then require our baby to be sent to the NICU, which is on an entirely different island, on a walk.
Yeah. And so when we went in for the C-section, they didn't even wait until he was back in the room. They said, "Oh, well, he'll be in the room and you'll be numb." And they laid me down on she gave me the spinal and laid me down on the table, and she started to poke around just to, asking me, "Are you numb here? Are you numb here?" And I was telling her, on one side I was, on the other side I was not numb at all. And I said, "I can feel that right there." And eventually she just takes her scalpel and just slashes, and he saw it. He was like walking into the room when it wasn't even a slow cut. She just went at it.
And Sam was shaking
off the table.
Shaking off the table because she could feel her entire C-section.
You could feel one whole half of the incision happening, and the nurses were holding my legs down because I was shaking off the table so profusely. When they got him out, he was screaming. He did not sound like a baby that had been in distress.
His color was good. He was
his APGAR scores were 7 and 9. I think it was 7 at first and then 9 after only a few minutes. He was swinging. They were commenting on how strong he was.
And Sam asked if she could see him, and the nurse just yelled no and ran out the room with him into the nursery. So she never even got to touch her newborn baby.
Didn't get to touch him, didn't get to see him. She quite literally yelled at me no. They took me into a recovery room for the C-section, and because I could feel everything, the anesthesiologist had been bolusing me with fentanyl the entire time. I don't even know how many boluses she gave me.
She was standing over Sam and slow pushing and just kept bolusing fentanyl to her.
Because I was shaking so profusely. And when I got into the recovery room from the OR, I had been in there maybe 60 seconds when 2 nurses came in. She had a clipboard. She said, "I need you to consent to these vaccines." And I said,
She
I've
was
never,
still shaking.
I was
She
still shaking. I
couldn't
said,
even
I
put a
don't,
sentence together.
I was like, I can't even, like, I'm on drugs. I'm like, I have just gone through this. Like, I can't think, and I've never had a baby born at 29 weeks. I need to talk to a doctor that I
And we
trust.
asked them what are the vaccines, and they said, oh, it's Hep B and vitamin K. And we both looked at each other and we were like, well, can we hold off? Like, we would like to hold off. And at that point, both nurses stopped,
They looked at
gasped,
each other. They were like,
and looked at each other in a very threatening manner of like, do we have to call somebody?
and she goes, well, you at least need to give him the vitamin K because he could have a hemorrhage.
She walked out for a minute, came back in, and gave us a piece of paper. She had a clipboard and she had most of this paper covered. We didn't notice, like, the way that she set it up. She folded the paper down and then had other pink paper on top of it.
She said, this is for the vitamin K. And I remember, like, looking at him, like, I didn't want to give him anything without talking to a doctor or somebody, just having the time to, like, even read what happens with a baby that age and how they tolerate things like that. Because,
And also, sorry to interrupt, but this is really important. How much did he weigh?
2 pounds 6 ounces, 2 pounds 7 ounces.
I'm sorry, so I'm just going to go to
Exactly.
Angela for a second. Are you allowed to vaccinate a baby with Hep B at 2.6? 2 pounds.
When you look on the CDC guidelines, as well as American Academy of Pediatrics, you are not supposed to vaccinate a baby less than 4.4 pounds with Hep B. You're supposed to wait a month and or a discharge. And so this baby was 2.7 pounds, 2.6 pounds, and was given 2 doses of the HBIG and Hep B within minutes of birth.
Within minutes, within 5.
So you declined, and they gave it anyway.
They gave it
And Angela, I need you to explain. He had 2 doses. He had Hep B and this HBIG. Explain what that is for our viewers, please.
Yeah, so what their probable justification was that they marked her as, unknown prenatal care. This is a woman who was seeing midwives. She's had other babies. She had other previous babies in this hospital. And so the hospital knew her Hep B status because she had delivered other babies. And she declined it. Parents have the right to decline. And this is not a mom that's Hep B positive. So I know hospitals do that in circumstances where the mom is Hep B positive to protect the baby from getting it. But from a mom that knows her Hep B status and a mom who declined the Hep B, it's not indicated. It's actually contraindicated. And I just can't imagine for a 2 pound, 7 ounce baby who is needing respiratory care. I mean, you're worrying about all kinds of other things on a baby that small. You're worrying about their lungs. You're worrying about their glucose, their temperature regulation. The last thing on my mind would be, let's stop and give this baby 2 doses of a vaccine when it's this tiny. It just doesn't seem like it should have been the priority. Plus, you can't, it's in my mind, it's assault and battery. The parents declined it. And it was given regardless.
And just to tell the viewers, HBIG is hepatitis B immune globulin. It is a human blood product. So anybody's blood could be infected or in that, right?
Sam sent me into the nursery. She's like, you got to go be with him. And I went into the nursery and they had already administered the vaccines, but they hadn't even put oxygen on him yet. So the priorities were...
were those. And it was interesting too when I did a little research after I found out, and you're supposed to be given, it's like a federal law that you're supposed to be given this entire vaccine information sheet on those specific ones and given proper time to read through them and make an informed decision. And I most certainly, there's no way I could have been given that and had the time to do that within 5 minutes of his birth.
Plus you were drugged.
And I was on so many things. I mean, I was so out of it. And I told them that, like, I'm on so many drugs right now. I can't even think straight. Like it's not possible. And they just, she told me, oh, this is just the vitamin K. They made it sound like, you're a horrible, horrible parent if you don't at least give him this vitamin K. So sign this, we'll move along. And then when we were being discharged, they handed me the vaccine card. And I looked at it and I saw that it had not one, but two. And I was floored. And I said to the nurse, who administered these? And she said, I don't know. I wasn't here. And
I can't give you the name.
And I said, you know who administered them. It's in the charting. Like, she has to check those things out of the drug boxes. And she was adamant. I don't know who it was, was very attitudey with me. And I even went as far as asking the doctor who discharged me. Never saw the doctor that did the C-section. She never came in to check on me again.
And for the 12 hours after birth, they denied pain medication.
Yeah, they made a charting error. And so after I had the C-section, they came in and they gave me pain meds for a couple of hours. And then at midnight, because of the way that the timing works, whatever they had given me, it had a ton of Tylenol in it. And the doctor who had performed the anesthesiologist had gone home. And so they were like, we can't give you any pain meds because you're over your Tylenol threshold. And
we cannot contact her because she's off of shift. And so Sam was 12 hours with no pain medication immediately after C-section.
Yeah, it was at midnight and I went 12 hours without it in grueling, excruciating, miserable pain. I've never had a C-section before. And I was one of the most painful experiences of my life.
And the wild thing about all of this is Kit is remarkably strong, and because of the events that set off for him, he is still in the hospital
with a tracheostomy.
He has a tracheostomy at this point, and he has experienced a slew of medical abuses and literal malpractices that happened by way of intention at the hospital that he was sent to. It was a very systematic pattern of abuse that we have discovered, that this is normal for babies to be sent to this hospital in this fashion so that they can then be essentially milked by the system for their state insurance, and just keeping them sick or dead.
What's surprising to me, Polly, is it was like a couple of weeks ago, he was on a ventilator and he's, fighting for his life. He's just the sweetest little boy, but they were coming into the room with this piece of paper like 3 times asking them to consent to 9 more vaccines while he's in the hospital.
5 days post-op from his tracheostomy.
Yeah. And this boy has never left the hospital. They're wanting to give him 9 vaccines. And they called me asking, do we sign this? And I said, just don't even sign it. Like, don't consent to it. Don't sign it. It's just a way of coercion and to make them feel like bad parents, that they have to sign this form, that they're refusing these 9 vaccines. And if they refuse, that their baby could die. I would think the priority is keeping him alive and getting him healthy and getting him off the ventilator settings. He's not even in school. He's not out of the hospital. He's not in daycare. Why are you so worried about giving him these 9 vaccines?
Yeah, and by signing that said form, it says on the form that you are knowingly endangering your child by delaying vaccination. And the doctor that recommended all 9 in the same dosing also the same day was heard right outside of our door saying, after 2 beers and a glass of wine is when I do dumb things on the internet.
This is the man that had just for 2 days in a row come into our room, given us this form, heavy-handedly suggesting that we give him 9 vaccines at once, 5 days post tracheostomy, and that if not, you need to sign this paper that says I'm knowingly endangering my child's life. It's just.
What did he mean by
they gave the baby the wrong breast milk? There's just been so many errors, and it just goes to show, like, people need advocates when they go into the hospital. Even though you advocate for yourself, I do not want this for my baby, it still ends up happening. And so
at one point we were actually removed from the hospital by security under the direction of the NICU administrator for obstructing care, because we asked for a doctor to come when our son was having a seizure.
It's been a nightmare.
So you advocate and you get
Nightmare. Okay, let's just wind back a bit. So he's born, given him the vitamin K, Hep B, we now understand. Then what's his health like after he's had those shots? Because we're 8 months now and he's never left the hospital.
It's been pretty.
17 days into his hospitalization, he was at 26% oxygen just on nasal cannula. Everybody was telling us, oh, he's going to go home in about 4 to 5 weeks. We can't give you an exact time, but he's doing awesome. And then a nurse broke protocol and wanted to put him back into his isolette. Mom was holding him. She wanted to put him back, and it was shift change. So she wanted to do it quick. He was supposed to be moved by 3 people, including an RT, a respiratory therapist.
So essentially,
she moved him by herself.
She stacked him on top of his ventilator tubing. She stepped on his PICC line, and it jerked his body down. All the water from the ventilator flooded into his lungs because they humidify the ventilator. So in his cannulas, they're taped on. All the water just flooded into his lungs, and instead of charting it or letting anybody know, she chose to hide it, did not chart it, didn't even tell the next nurse coming on. And he declined pretty rapidly after that.
Within hours. So he was at 26% oxygen. 2 hours later, he went to 55% oxygen. 6 hours, it went to 70. And then 2 days later, he had pneumatocyls present on his lungs.
This was the day his lungs collapsed. This picture right here.
So his lungs overinflated like a balloon. And then a few days later on that photo, his lungs collapsed.
And they told us he was going to die. Come say goodbye to him. And it's just been, that could have been prevented had it been charted. They probably would have come in, done an x-ray, seen the water, and they could have intubated him and suctioned a large portion of that water out, but they chose not to. And we don't know the full extent of what damage happened to him from those vaccines he was given initially, but we do know that the side effects can be, apneic events, I think issues with like episodes of really fast breathing, tachypnic episodes, which he was having that the day he was rained out. He was doing really good, but he was having these tachypnic episodes. He had been having those since he was born, and they were unexplained. They had no explanation for why he was having those, and it just seemed like every time he would get better, something else would happen. He would survive miraculously, and then they would intervene, oftentimes,
and injure him again. So he would start to do amazing, and then he would be set back, even to the point where he was ready to come off of a ventilator again and was doing so well. And then his doctor came in and said, I'm going to do something crazy. And she put him on CPAP at a flow of 12.
Which is really high.
CPAP 12 is extremely high. You can't breathe over it. And so it set him back entirely to re-intubation. And then they kept him re-intubated for over 2 months. Mm-hmm. And he already was at the point of, he was in the parameters for extubation, and they didn't do it. And he got 3 different infections in his lungs.
Really bad infections.
And that's when we got kicked out of the hospital. Was we knew he had infections, and we were asking them to run an infection panel, and he was presenting with a seizure. And instead of caring for him, they kicked us out, and they did not run the infection panel.
Yeah, we asked for a doctor to come to the room. We asked the nurse to please stop. He was having a seizure. And we asked her, she was just she just wanted to mix fortification into his breast milk. And we said, can you please just pause what you're doing for a moment and go get the doctor? He's, it looks like he's having a seizure. We need help. And instead of the doctor coming, a security guard came and basically told us, you need to leave right now. There was a charge nurse holding our baby while he's frothing at the mouth. We video recorded it. You can find it on our Instagram. But the last thing that we said to the charge nurse was, will you please let them know about the vomit? And she said, yes, I will. He is sick. His seizure never entered the chart. His vomiting never entered the chart. We were barred from our child for 7 days while they were trying to medically kidnap him by way of the child welfare system. And we only got back in just through the miracle of all of the prayers and all of the people that stepped up to just be there for us and for him, and supported us in advocation, because even the hospital has what's called, they have a patient relations woman who's supposed to be your advocate. And Not once did she ever advocate. We asked, I think we asked 17 different times for them to run an infection panel on him, and
which we
nobody
have recorded all of these interactions with doctors, with nurses, asking, please run an infection panel. So after they let us back into the hospital, they transferred him from the NICU to the PICU. And the day he got to the PICU, his nurse noticed his secretions were tinged, and she ran labs and found that he had 3 infections.
Really
and one of them required consulting with an infectious disease specialist because they didn't know how to even treat it. And then we had to figure out which antibiotic to put him on just to resolve the infection. And at that point, when he went to the PICU, they decided to paralyze him rather than dealing with gastrointestinal issues he was having from the fortification they were giving him.
His stomach was swelled up like a balloon.
His belly button was sticking out this far.
And they just, it was like never wanting to actually address what his actual underlying health issues were. It was always wanting to look the other way at something else. And it just kept stacking and stacking. I mean, by the time that he had sat with these infections for 5 weeks, he was so ill. You could see it. His color was, barely there. They paralyzed him, and this paralytic itself causes respiratory decline. So the paralytic itself creates all sorts of phlegm and mucus in the lungs, which is the exact opposite of what you would want for a baby who's having lung issues. And
so we have an anatomically healthy baby that was brought out early and then given this vaccine and then set on a trajectory of constant injury. And then the way that everything was charted, it just puts it all back on him as his own disease of premature lungs.
Yeah. They spin it as though I declined the betamethasone, the steroids at birth. I had asked them 2 times to give me the steroids for his lungs before he was born, and they point blank told me, no, we won't. And I asked the second doctor who had come in, what about the steroids for his lungs? I think it would be best to get them. Again, he was like, no, it's up to the other doctor. Like, we're not going to do it. And the way that, the way it gets spun to any new doctor coming on is they come up to me and they say, so you decided not to have the betamethasone, which is entirely.
We were begging for it. And at the very top of our chart, it says no prenatal care, which in the hospital world means drug addict, reckless, and doesn't deserve to be a parent, when that wasn't even true. That we had prenatal care. It just wasn't with one of their OBs. But just that framing of the chart sets you off for an entire discriminatory experience within the walls of the hospital.
Yeah. This is just a horrific story. It's horrific. And we're so sorry. And baby Kits, I can't bear the thought that he's just suffering so much under the care of these people. Angela, you're there. You came in to assist and help, which we're so grateful for. What can we, the people, do? Because we've got to get that baby out and into doctors in our movements that will love and care and try and make that baby better. I fear for what they might do to baby Kits.
So the best thing to do is to help this family and kid is to donate to their GoFundMe, because there's a long road ahead. We are working on getting him transported back to California. I'm there. I can help out. And I know all, amazing doctors that can, oversee his care to make sure that he's safe and well cared for. But just helping this family, it takes a lot of money to just pack up and go. And this poor family has been, 24/7 at the hospital, not being able to see their other children. It's just a lot. So any help with donations is and prayers, prayers and sending lots of good energy and all of those things are helpful.
And what about legal? Have we got legal in place?
We're working on that right now. It was so hard to find any attorney that would touch this case.
They only take a case if the baby's dead.
Yeah, but we were able to find a really kind-hearted lawyer who showed up when we needed him, when we were separated from him in the NICU, and he was the person that helped get us back in. We had everybody on the outside sending letters and putting pressure on the hospital, and then he stepped in, contacted their lawyer, and was able to help negotiate a way to get us back in.
And for what needs to happen,
we need a team of lawyers.
We need a team of lawyers to ensure safety for other babies. This is an 80-bed NICU.
Yeah.
And it is a revolving door of unordinary healthcare.
Yeah. We've had a lot of other families come forward, and there's a little bit more about that on my social media. You can see a lot of the families that have come forward with painfully similar experiences. It's a really common thing at this hospital. We are right now we've been talking with Angela. There's an attorney that works with actually your guys' team here on Oahu that we're gonna connect with and just see if moving forward we can kind of get the ball rolling on, because we birthed in one hospital and then they transferred him to another one. We have to, I think we have to deal with two different legal lawsuits, but we want to just get that started. So we're trying to connect all those dots as we speak.
Well, you're in the right hands with Nurse Angela, and you've got Children's Health Defence right behind you as well. So I don't think they want to mess with Nurse Angela and Children's Health Defence. So you're in the right hands.
Her being here has changed the trajectory.
It really has.
Of course. Angela knows
They've
exactly.
been giving excellent care.
Yep.
Now.
Yeah, I was all day with him. Was it two days ago?
Mm-hmm.
And the nurses were on it. They were in there. They were turning him. They were suctioning him. They were fantastic. They behaved.
Yep.
Yeah.
We came in and it was, his door was closed, and it was, we both were like, wait, what's going on here? And we had to transfer him already once to another NICU on island just to get him out of the first situation. And we brought him over to another NICU where it hasn't been.
It's less nefarious, but it's still negligent, because the standard of healthcare on the island is just so subpar and so delayed.
He got staph infection right after he had his surgeries. They used scissors that were just floating around his room to snip his surgical sutures from the G-tube T-clamps. And
they let a training surgeon try to snip him, and he poked around Kit's belly for 2 minutes and never even made a cut on the clamps, and then nervously handed the scissors back to the other doctor. And we knew, we even mentioned to our nurse afterwards, that was not sanitary. And then a week later, he has a staph infection around his G-tube.
His eye was another. They
do ROP eye exams on the preterm infants,
which are needed for babies when they're on high forms of oxygen. The retina can detach from the back of the eye, and it's entirely understandable. I went through the experience with my first daughter who was in the NICU, and when she had it done, the experience that I witnessed in that situation was, yes, it was hard for her, but the way they went about it was very respectful to my child's life. It wasn't this traumatic, miserable experience for her. It was tough, but they were very caring in the way that they executed it. In this situation, it was unsanitary, it was unstable.
Kit had 5 of these eye exams where they open the eye with a speculum and then put a metal rod into the side of the eye and look behind the eyeball. But they don't properly sedate, they don't properly prepare the baby, and they withhold their feeds because most babies vomit from the trauma that's induced from this.
So that big bump you see on his eye, they called it a sty when it popped up. But what happened was they did his eye exam and they ripped into the bottom of his left eye? His left eye. Yeah, right into the bottom of his left eye. And when we stepped over to the isolette, because we were in the corner of the room, they wouldn't let me be right next to him for this particular eye exam. I could see there was blood that had dripped out because they had ripped. You could see the swelling
inside
on the inside of the eyelid, and the nurse was just blotting it up, and his eyes they looked like black eyes. He had 2 totally purple, bruised eyes. And
that injury, it's 3 months later, and that injury is still visible on his left eye.
They did 3 or 4, was it 4 more eye exams after that? Mm-hmm. They did 4 more eye exams after that on
top of the injury.
And it was this gigantic, huge, swollen, pus-filled sty that eventually it popped and drained white and green pus all over. It came out of his eye and from the front, and they still continued to do these eye exams.
All of that said, Kit never deserved any of this. He
Mm-mm.
doesn't deserve any of this. He's an innocent, beautiful baby that has just been obliterated. And we have to do so much to resolve that and give him a beautiful life after the fact. Give him a whole slew of therapies with real medical professionals that can offer him healing and just love him tremendously. And so the hope right now is to get him to California, where he can be seen by a whole different team of people that are at a higher level of, a higher standard of care.
Yeah. We want to get him to California, where he has Angela, a lot of different medical professionals that that are in the realm of people that we know their character and that we know will take care of him and take care of us
and their results.
Yeah, and just bridge him into at least stability, because with a tracheostomy and a G-tube, that alone is that's going to be a huge setback for him, speech wise, everything. Not to mention just the trauma that he's endured.
No, it's actually abuse at the highest level. And as far as I'm concerned, I'm just so sorry for baby Kits, and sorry for you all. But you are in good hands with Nurse Angela, and our people, the people watching now, will share this and get it out. And so people will contact Nurse Angela like they always do in our movement, and we will get this fixed. Please do come back on and keep us updated on CHDTV, please, because I know everybody's going to be concerned and praying for you. And again, just give us one last time your Instagram where we can follow you.
So it's at The Divine Union with an underscore at the beginning. So it's at The Divine Union. And there's a lot of info on there. There's story highlights that share the time flow of everything that happened. And there's also Kit's story on there. And then there's links to our GoFundMe on the Instagram as well.
Well, thank you for coming on this morning, and we really do look forward to getting you back on again, and we'll be praying for you and donating for the people that can. And Nurse Angela, thank you again for just being out there, doing what you do. Thank you.
Thank you so much.
Polly.
We're so grateful.
I hope the next time we talk that it's like
really good,
more positive updates about Kit.
Yeah. Thank you.
And I hope that too. So, but thank you so much for being on this morning.
Thank you.